This is Health on the Plains, a podcast about rural communities, rural life, and the many factors influencing the health and well-being of rural Kansans. Health on the Plains is a podcast from the Kansas Health Institute, a nonprofit, nonpartisan educational organization committed to informing policy and improving health in Kansas. Through honest, nuanced conversations with leaders and doers from a variety of backgrounds, the Health on the Plains podcast offers unique insights into rural health challenges in Kansas and shines a light on the people and organizations working to make their communities healthier, more vibrant places to call home.
Welcome back to Health on the Plains. We're here at the Parolo Education Center in Pittsburg, Kansas, at the Community Health Center of Southeast Kansas. We just wrapped up a phenomenal conversation with Dan Duling, who is VP of Community Partnerships, all about how we build trust in communities, how we develop partnerships, build relationships to grow access to care here in Southeast Kansas. It's a wonderful conversation with lots of lessons learned. Dan's a really insightful guy. We hope you enjoy the conversation. Welcome to Health on the Plains podcast. We're here in Pittsburg, Kansas. Now, some listeners may say, what are we doing in Pittsburg? Pittsburgh's not very rural, especially if you're from a town like Ness City, like mine, with less than 1,500 people. Pittsburgh, you have a university here.
We do.
Got this beautiful health center. But by many classification systems, Pittsburgh's still rural. And our guest today, Dan Duling, is VP of Community Partnerships at the Community Health Center of Southeast Kansas. And Dan's work absolutely extends into rural areas outside of Pittsburgh and in the region. Tell us something you just really enjoy about this region, about this area, and being down here and working down here.
Well, my wife and I and our family are from Southeast Kansas. We had a little 10-year stint in Olathe, which was wonderful. Get to experience living in more of the suburbs. But Southeast Kansas has a very unique love of neighbor and support of neighbor. And that's something I've come to love and appreciate. And it's at all levels. I grew up on a farm with my folks around Walnut, Kansas. And I always tease about that's a suburb of Erie, which Erie is very small too. But whether it be your neighbor as a farmer, or your colleague at work, or my connections to Pittsburg State, and the connections I've made as an education person, being a teacher and a principal at elementary school and a special director. I still have connections to friends at Pittsburg State and to the families that we serve. So, it's been such a natural move to go from the classroom to building administrator to partnerships with CHCSEK. I know a lot of these people. Some of them are much grown now, but I can tell you a story about that later. But yeah, They really are supportive of each other, and we try to figure out what we need to do to make it best for humans in Southeast Kansas.
I wanna now go back a little bit and think about the history of Community Health Center and some of the inspiration. And you talked about part of what brought you back, and what you love about this community is how people care for each other as friends and as neighbors. And the roots of Community Health Center Southeast Kansas go way back.
They go
back to 1903 when Mother Mary Bernard Sheridan, a sister of St. Joseph, brought healthcare to the region. And she is quoted, and I think you have somewhere in your building on the wall.
We do.
She is quoted as saying to her staff, "Do all the good that you can do for all the people that you can in all the ways that you can for just as long as you can." When you think about your role here at CHCSEK, and you think about the organization more broadly, how does that quote resonate with you?
It reminds me of another phrase that a lot of people do, is just do what's right when no one's looking. CHC, SEK isn't about being sage on the stage. Yes, we are the largest health center, community health center in Kansas. In the United States, there are approximately 1,400, 1,400th being the smallest, one being the largest. We're at that about 58 mark in the United States. So, but that all being said, in our society today, we're big and bold, right? CHC is not, that's not the mission. It's put your work to the shoulder, put your shoulder to the work, and do what's right and help communities. So, and to Mother Mary Bernard Sheridan's quote, do all that you can. That's part of my partnership is maximizing partnerships. And I am only one small grain on the beach of work here at CHC. I am only one small part. I was just in a meeting yesterday with the VPs and the chiefs, and Chris Poste, our CEO, and Jason Wesco, our president. And it becomes a little overwhelming when I hear all the things that are going on, and the technical level and complexity that people are working and doing. So, and you're doing it for all the people you can. So we talked about neighbors, right? And interesting enough, I hope I can remember to weave this through. A lot of times when you think about a community health center, the population of people you're thinking about are usually maybe people in poverty. So I want to flip that for you so you know where CHC SEK is. We have 75,000 patients. Only 14% of those have no insurance. We have a majority of people that we are their primary care source in their community. So, in fact, we're their preference. We're their choice of healthcare. So that really flips people on their head, going, "Oh, I was thinking community health centers were for the poor," and that is absolutely. It's about access, all access. And so, that being said, we're really continuing to focus on. We always want to support the folks who are needing most access. But you know what? We've got a lot of what I would consider middle class income who work very hard. They have a job, they have insurance, but they're kind of struggling. If you're a single mom or a single dad with 2 kids, that's hard. And so our role is to focus on everybody. And so that's a little different than what sometimes people perceive.
And to provide a level of care and a level of access to care where you can be the choice of anyone.
Yeah, exactly. As when you guys walked in today, our campus is gorgeous, and our clinics that are out there, they're really gorgeous, and they're clean, they're efficient, all the things you would want. Because healthcare is really personal. If you walk into a facility and it's well kept and well lit and friendly, gosh, this is my choice.
And I think that can be a really powerful approach. When I think about how we sometimes perceive rural communities, when we talk broadly about what amenities do folks have, what resources do folks have, I think we can sometimes assume that the best versions of things are in the cities, and that the rural places get what's left, or there's this perception that maybe rural isn't to the same level. And from everything I see, and you've talked about, Community Health Center of Southeast Kansas is aiming for the best that they can provide for all the people they can provide it for. And I think that's a really powerful thing when we think about how people perceive healthcare in rural communities.
Well, and to that point, our leadership was very wise in understanding that the current and needs of patients are 24/7.
We've started to sort of talk about the growth of Community Health Center Southeast Kansas. You're one of the biggest in the U.S. and you've expanded into new areas and new partnerships. And unfortunately, when we think about the conversation we have around rural healthcare, often it's the opposite story.
Right.
And a lot of times it's a very true and real story that rural healthcare areas are losing access, or rural communities are losing access to healthcare. There's fewer services being provided. There's a loss of providers. And quite frankly, you all are the opposite. You're expanding, you're growing, and you're expanding purposefully to provide better and more care. But some people could be wondering, very simply, what's going on? What's the secret sauce? How are you pulling this off? And I know there's probably no easy answer.
Sure.
But I imagine part of the answer is the relationships and the partnerships that you've been building.
Yeah, that's true. I want to start with, as we all know in any organization, whether it be KHI or anywhere, it starts with the leadership, the vision and the heart of leadership. And our leaders here at CHCSEK, Krista and Jason, our chiefs, our VPs, they're passionately connected to and committed to the mission. So first and foremost, if you're faint of heart of work, then you might want to move down the road, because this is not the place you would want to be. But if you have a real serious mission of work to help people in multiple facets, I know we talk a lot about healthcare, but we have a large footprint with mental health and growing, and we can speak to that. But so just being committed, but our leadership sets the tone. And I think that's first and foremost. And it just oozes over everyone in the agency, in the organization. I tell you, the other thing that I am most impressed with, and I'm really appreciative, is we are absolutely data driven. I am so appreciative and in awe of the robust data system we have here. Data is used to drive where the need is, and especially when we're invited to a community, and that's key. And we can talk about that later. But when the community goes, I think this could amplify some things we're already doing, like it would create some new jobs, workforce. Yeah, right. It would greater access to healthcare, and then there's all those little tentacles that happen. You know how it works, a domino effect. But so having that data driven is so important. Success breeds success, and so that's true of CHCSEK. We go into a community, we're invited into a community, we talk to the community, we establish a potential patient base there, services, and then people go, gosh, yeah, this is good. And then the neighbors talk to the neighbors, and it grows. So that's part of the secret sauce. And not complicated.
There's so many pieces in what you talked about, but starting with what you just mentioned, part of that only it happens if, as you said, you are successful, and in this space that means you provide the care you say you're going to provide. It's a high quality level of care. You keep your commitments that you say you're going to a community, and that leads to more buy-in and more relationships. The other two pieces, when you talk about if there is a secret sauce, two ingredients I heard. There's leadership and a commitment top to bottom of mission-driven folks that care about this community, that absolutely want to continue to carry on the mission charge that Mother Mary Bernard Sheridan gave to do all that you can do. So it's that mission-driven passion, commitment to provide and do everything you can, combined with really high quality data and insight and planning and really sophisticated intelligence, and you bring those two together, and those two ingredients seem like the core of this secret
It's
sauce.
a win.
Yeah.
It's a win. You know, one of the really neat things about community health centers in general, but there's a very high standard for quality and quality measurements. And we have an outstanding team of folks who that's all they work on and look at and crunch the data on. And if the needle's not moving, what do we do different? And we're not talking about a talk about it meeting and then we'll think about it in 6 months. We're talking about this week, next week, how do we move the needle?
Yep. You talked a lot about the work you do to build relationships, to build partnerships, and a lot of that results in new approaches and new partnerships that bring care into new places. Before I ask you about some of the specific examples and some of your favorite examples, I think it's worth pointing out that I think this is a different approach in some ways than how we sometimes think about healthcare. I think when we think about building access to care, sometimes the approach is, let's build the best facility we can in this place that's relatively convenient for the organization.
Sure.
And let's make it as great as it can be, and then hope that people come. And sort of hope that they can make it to that facility. And don't get me wrong, you're building amazing facilities. This building that we're in right now is phenomenal. But it seems like you're also saying that's not enough. You're saying, how can we, when we're invited into a community, how can we extend our reach to provide services there where people are? How can we build partnerships with a school to be in the school and provide services there? Not say, come to us all the time, but how can we meet you where you're at? So with that sort of framing and thinking about all the partnerships, what are some of the unique partnerships and relationships that you've built to do some of that stand out for you?
Well, a phrase that I heard that resonates with me is there's sick care and then there's health care, right? Two different things. When you are not feeling well, you need sick care. We do that, plus we do health care. So, for instance, and I'll segue into being partnershiped with locally grown produce, right? So because we have food as a prescription.
Oh, awesome.
Yeah, I mean, that's not rocket science. We know if you eat well, you feel well, you stay well, right? But it is more complicated than that, because eating good food is expensive, and there's no way around it. So if we can help people either get back on track to eating well and do food as prescription, but then we've created some partnerships with some of our local producers of food.
You took the next step. Say, how can we...
Exactly. So we're talking about healthcare, not sick care. And they're both important. But so doing that has been really interesting. And some of our local producers of food also have an influence by sharing that with the schools. And then we have students who are going, so in Kansas, we're ag-based. Usually you think farming, you're thinking multiple acreage, big tractors, $1 million, I'm out, right? Unless it's a legacy farm of some kind. But what if you were talking about, locally grown greenhouse production that's sustainable and affordable, and you can make an income? We try to partner with those people. Very cool. That's one example.
That's really cool.
So here's a new one we're working on right now, and it's just hot off the press. As I make new friends become partners, which friends and partners are two different things. Friends are friends, and partners are, we're sharing the same sandbox and have to figure it out. But we are now working with a lot of our universities. We've always had a wonderful long-standing with KU, of course. Now we're making new partners, stronger partners with our local Pittsburg State University. Has much to offer. We are now the healthcare and mental health care provider on campus.
Wow.
Which we're super proud of. And the students were already coming to our clinics here, but now they can stay right on campus if need be. Our latest venture, though, is with K-State. So you think, wow, what is K-State and CHC Southeast Kansas? What do you have in common? Well, we had a visit one day with all of the local extension office people. They just needed a room to visit and meet. And so K-State president came and his leadership team, along with many of the extension office folks. My family and I, we grew up in 4-H. Our kids showed horses. Our oldest daughter went and was on the equestrian team for K-State, so there was lots of good connections there. I just kind of knew that world a little bit. And so I got to thinking, well, who is very trusted in rural communities with services that's already established? Your county extension office.
They're there. All across Kansas.
All across Kansas. I thought, well, who is providing trusted health care and mental health care and services in small... I think I just described CHCSEK, right? And so I reached out to the leadership at K-State, and they said, that's simple and beautiful. So we're starting to work on how do you... I think it's an efficient concept because we're not creating a new model from ground up. Extension offices are already established. In many cases, the trust is there by the community. They're providing good service. They have lots of things that are beyond what many people maybe even know offer, right? And here we are, maybe a potential clinic in town. We're at the school. And how can we amplify what both are doing? So that's another example.
That's really neat. And when a phrase that I have heard in some of my work, talking about collaborative work and partnerships, is that they move at the speed of trust, and that's been a really powerful thing for me to think about. And when I hear you talking about how you're building these partnerships, you keep bringing up trust and finding folks that are trusted and building trust with your partners. And I imagine that in a lot of cases, your work is moving at the speed of trust, and that's the right speed for it to move. Another thing that I heard you say, and it makes me think about when I asked you about federally qualified health center, and you said, sometimes I don't focus as much on the federal part.
Right.
And when I heard you talk about your approach to building relationships and growing care, you said you looked around in your community and in your region and said, what's the good stuff that's already here? There's already resources here. There are already people and organizations doing good things. How do we build on that? How do we leverage that? It's a very local approach. And you're not looking to the federal skies and saying, what do we pull in? You're saying there's resources here, there's expertise here. How do we build on that and leverage that? And I think that's a really, really powerful approach.
I appreciate you noticing that and thinking about that, because my school background, and I'll make this really simple. So 85%, if not a little higher, of a school budget are people, not the bricks and mortar, not the football field. So when we go, the biggest, the best, the richest, the most robust resource in a community are the people. Are the people.
Absolutely.
And it's amazing the talents and work-driven people that are in those communities. And everybody wants the best for themselves and their kids and their families and their community. So when we go in, we really think about, what are the people's needs? And it's not just medical needs or the needs that we produce, is maybe they're going to be able to provide us some people resources that are going to enrich our
Absolutely.
our environment.
There can be mutual.
It is absolutely mutual.
And there's probably, it sounds like there's a lot of listening too.
Oh.
You're not coming in and saying, we are great. Have you heard about how wonderful Community Health Center Southeast Kansas? You could say that, but you're coming in and you're not sort of saying, we're so great, we have all the answers, do what we say.
Absolutely.
It's much more collaborative.
My dad said there's a reason we have 2 ears and 1 mouth. Right?
Absolutely.
Yeah.
Absolutely. So one I love those examples. And all of them, a common theme is building on local resources, building on expertise, and leveraging the best resource that we have, and that's the people. That's the people there. And I want to ask you about another specific program initiative that I know you all do that I think is really neat and hits at a challenge that we often see in rural communities. We know that we talk about access to healthcare.
Yep.
You could put a clinic 2 blocks down from my house, but if for whatever reason I can't physically make it to that clinic, then I don't really have access to the services there.
Mm-hmm.
And you all have a program that's in both Kansas, or leverages grant dollars from both Kansas and Oklahoma, because you've expanded into Oklahoma, and it's called Caravan, and you offer transportation services to folks. Can you tell me about how any background and sort of thinking on that resource? Because transportation is a challenge that we hear often when we come to rural communities. We're just set up in general. We're spread out a lot of times, and so how what was some of the thinking, and how did that partnership and relationship?
Well, this might be a little bit of a stretch, but I'm going to correlate to the origination, the vision, the spirit, the mission of CHCSEK in the beginning was to get students ready for school, right? Make sure you're healthy, and so that's the original centerpiece, was have kids ready for school. Because if you don't feel well, you don't, and you know what happens then. So that being said, if you can think in concentric circles, what do schools already provide in rural Kansas to get you to school? Yep. The big yellow buses, right? So it's not complicated, and that is a service that is trusted. More word. And it's very local, right? So why not healthcare? Why not mental health care? Have access, have a ride to get there.
Absolutely.
So it's not. So the vision was very clear that it is a barrier. It's probably, if not the top barrier for people accessing services.
It's always near the top.
It's always near the top, right? So our leadership again, who said barriers, we knock down barriers, we figure out how to make that work, said, you know what, we did a data analysis, we took a look at, is that an assumption or is that a truth? Right? So a lot of times we get assumptions mixed up with that's the truth. And in this case, it is true. We knew it was, but we wanted to verify. Yeah. And that being said, we said we've got to figure out a way to get a transportation system put together. So it began with getting transportation for patients to access their care. All right. Then our super smart leadership and people who are mission minded here at CHC said, you know what? I think we don't have public transportation in rural America. Zero. I mean, so why don't we figure out how we could work with KDOT to help provide transportation for other things than just healthcare? Because you go, well, yeah, what are you gonna, take them to the grocery store? Yeah. Guess what? If you eat pretty well, you're gonna stay healthy. It's all connected again. It's the whole person. If you are stressed out because your loving pet needs to go to the vet and I don't have transportation, or I'm an elderly person and I just need transportation. We figured that out. Guess what their stress does? It goes down. Their family pet is well again.
Yep.
It's all connected.
Absolutely.
And so the thing that I think is super smart on CHCSEK's part is that we also look at the business plan,
Mm-hmm.
because it's super important to make sure that it's sustainable.
Mm-hmm.
These can't be flash in the pan, fantastic.
And then
It was a 6-month grant, and then yank away the service.
it's a good way to lose trust.
That's a lose trust kind of activity.
Mhm.
And our leadership here is very clear about, I want to see the plan, I want to see sustainability of the plan over time.
Yeah.
And so that's where that's at now. And now we've built a business plan that makes it sustainable.
So there's both this balance of a willingness to be innovative,
Risk-taking.
to take some risk,
Yep.
and at the same time to constantly be evaluated and learning all the
Yeah.
way, so that you don't take a risk that you really weren't set up to succeed in.
I'll give you an example. We have a community health worker that works through one of our hospitals.
Mhm.
So when a person is discharged,
Mhm.
when they're discharged, then you're kind of on your own.
Mhm.
So we don't want them to go back into an emergency room situation,
Yep.
readmitted to the hospital. The hospital doesn't want that either.
Right.
So a community health worker who has to have a certification but not a degree, so it's money well spent on salary, right? And they're good at what they do. An example would be, another one is, we have community health workers who are called, that are connected to patients
Mhm.
who live at their house. And we have one lady who will call the EMS
Mhm.
to come out, and when they get there, she couldn't figure out how to get her blood pressure cuffed.
Mhm.
Now, at the same time, you can imagine the cost of an EMS,
Yep.
and where you're probably going to go EMS,
Yep.
At the same time, in another part of the county, there's a true
Yep. If an
situation.
ambulance is here, it can't go there.
Right.
Yeah.
So we work with local PD, county, and EMS, and so we've now integrated ourselves into that system with community health workers. So we're trying to show, number one, it's always patient-centered, so
Mhm.
it's good for the person.
Yep.
That's first and foremost. But economically, it makes great sense.
Yep.
And then they're still connected to us.
Mhm.
So then the community health worker will say, while I was doing that visit, I noticed there were, maybe a little dementia, so potentially some mental health supports. There might be partnerships within the community, i.e. Food pantry. It could be community health center. It could be multiple things.
Yep.
So
Absolutely. One way that you've grown that might not be obvious based on the name, Community Health Center Southeast Kansas. I think by my count, when I looked at all of your places you can access care, over 20, and you've extended into Oklahoma.
And as well as anyone coming from the Kansas Health Institute, the health rankings. Oh my goodness, Southeast Kansas is very concerning, and our counties are really, and everybody's working hard but trying to move that needle. Oklahoma's even more challenged. So back to, we go where we can make the most difference, and that is in those small rural communities. Schools, I know we didn't get a chance to talk a lot about schools, but of course that's near and dear to my heart, but that's the epicenter of support and catchment and schools. It still is.
Yeah.
And we have health clinics, like full-on health clinics inside schools.
Wow.
We have therapists that get up every day and they work in the school.
Wow.
And all of that trickles down to, if you got, the student who's not feeling well, is it strep throat or is it just, sore throat? Well, a lot of our folks who work jobs where you are on a point system of missing work so you don't lose your job, or you lose hours. It can be all done at school. I mean, so we're it feeds back into employers and the whole thing.
You go where there is an ability for you to provide and meet a need, and that extended into Oklahoma, and it extends to the schools. And I know education and schools are something that you have a background in and you care a lot about, and it's absolutely true to my experience that in a lot of rural communities, the center of the social scene, the center of what people talk about at the dinner table, the center of what people think about is the schools. They're a bedrock institution, and when you think about meeting needs where people are at, schools is absolutely a place to do that. So it makes perfect sense.
It does. It really does. And when we talk about social determinants, gosh, they're it. It's like there's an equal sign and a school building picture.
And if you can help students be healthier students can be more successful in their education. That sets them up.
Absolutely. We really hope, like, for example, here at this new education center, the John Perello Education Center, the data is really clear that, for instance, where doctors do their residency, they usually stay within about 80 miles. The data is pretty clear about that. So the leadership, of course, here said, we know that, and we are a desert, and the docs are not getting any younger, and dentists. Oh my gosh, we can't even get into dental right now, and that's super important, but we do dental work. So that's the whole point, is if we can, hook students into thinking about care and take care of them at the same time.
And support them. And from you mentioned early on when you were giving us our listeners didn't get to see it all, but we got an amazing tour of this building, and you talked about as early as grade school, you're finding ways to connect students with this amazing resource here, see the potential in a healthcare, and you're not waiting around for folks to sort of come. You're saying there's a challenge, and we're going to be part of the solution, and how can we support that? And this building and all the resources that are part of it is some of that. So we talked about education, and you have a background in education. And one of my parents was a teacher for a very long time,
You told me that,
and so I have to ask you to lean into that, and so I think you'll be okay with this. I mean, you have a master's degree in education leadership, and you've worked as a teacher in that space. So I'm going to put you in teacher mode. So you're in teacher mode, and you're standing in front of a classroom full of folks that work at healthcare organizations in places like rural Kansas, and you're talking to the folks that are maybe in a position like yours that are trying to think about how can we grow our partnerships and grow our relationships. How can we continue to provide high quality care in our region? And you had to summarize your lessons learned, and you had to write them on the chalkboard. What are you writing for that lesson for those folks?
Well, we've used this word a lot, and we'll use it continuously, but that is build trust, just as you do with your students. They will, building that trust is just, so trust is a word. Just put it right there and underline it, and I think you need to create quick wins. We live in a society where we study it, we dice it, we look at it, it's 6 months later, it's a year later, we might do something. You gotta have a quick win. And that may be very, very small. It may be as small as, let's try food as medicine with a local producer who says, I think next week I could deliver you boxes of something. Or it could be, a school nurse assisting in some way at the schools. It could be our dentists. We do outreach to schools and go out there, and so just, the answer is yes, let's do it, follow through. You can trust us to do it well, but let's get it done now. this is not long term.
If there's a step to take, and you've thought about it, and you can see the benefit,
Yep.
Don't think that step is too small. Go ahead and take it. And
Take
then think about it and learn from it, and maybe you take a bigger step.
And another, just kind of a mantra of mine, but have a plan, but don't go alone.
Mm-hmm.
Have a plan, don't go
Don't go
alone.
alone.
And that's all about the partnership.
Mm-hmm.
So we always are, as you know, we're calculated risk takers, but we reach out to our partners and say, does this fit?
Mm-hmm.
Does this fit? And it's always best to be asked.
Mm-hmm. Mm-hmm.
Don't crash the party.
Yeah.
Yeah.
It's best to be invited.
Be invited.
And part of creating a space to be asked and be invited is building those relationships all the time.
And one of the things that I recognize is sometimes it's the systems that are getting in the way, not the people.
Mm-hmm. Mm-hmm.
And the people work inside the systems.
Yep.
And I'm not talking about CSEK so much, but sometimes systems can't seem to be as productive and amplify a partnership. It's just because the systems are built so different.
Mm-hmm.
It's difficult.
Yeah.
But that doesn't mean we can't.
Yeah.
Doesn't mean we can't. So that's what we're always looking to see. And I always go into those conversations with partners about the people we're talking to, you and I.
Mm-hmm.
We are part of families at home, and we're not just employees.
Yep.
We're part of someone's church group and a parent or something.
Yeah.
So anyway, trying to look at the system versus the people. And sometimes the people say, you know what, I think we need to change the system.
Mm-hmm.
And there it begins.
Mm-hmm.
So,
Absolutely.
and I think everybody has to have skin in the game.
Mm-hmm. Mm-hmm.
And that's the one thing I share with when I do legislative work is even the person that doesn't have any health care, we will provide it for them and or in insurance or anything.
Mm-hmm.
But we do ask about a little $5
Mm-hmm.
sliding scale,
Mm-hmm.
a little skin in the game if you can.
Mm-hmm.
I think that's the one thing that the Midwest really shows well, and as a centerpiece is, if I can, I'm going to pull myself up with my bootstraps. Now, right now I only have one boot on. Can you help me out? But have a little skin in the game. And the other one is just creating sustainability. I'd write the word sustainability. Sustainability, and that's true for whether it be our organization, the family structure. If you can create sustainability, other wonderful things are going to happen, and then success starts to build on success.
Absolutely. So we've talked about a lot of things, and this has been a wonderful conversation. I'm gonna take us back again, back in time. The seed for what Community Health Center of Southeast Kansas would become, as we talked about, was planted a long time ago, 120 years ago, with, by a sister of St. Joseph who just wanted to try to meet the healthcare needs of her neighbors and of this community. And I think today, Community Health Center Southeast Kansas absolutely carries on that mission, but it's blossomed. You employ more than 1,000 people. You provide care to more than 70,000 people every year.
Yeah.
A lot has grown and changed in those 120 years. And I'm not going to ask you to look 120 years in the future, but I will ask you to look a little bit in the future. So if we come back here in 20 years and we sit to talk about this region, about the health of Southeast Kansas, what do you hope we'll find?
Well, the ultimate hope is that all our friends and neighbors, the people that we serve, are in a better place in their health, in their mental health. And so that's always the goal. They are our focus, they're what we love serving and doing. So that would be the hope, that we're moving the needle and helping people be in a better place there. Probably what I can tell you won't change is our passion. In fact, it will gain momentum. I can feel it when I work with the staff and here at CHCSEK. The commitment, the passion, the hard work, I think it's only going to grow because the outside forces are becoming even greater pressures, and we all know that. In whatever lane of traffic you're living in, if you're wealthy or middle class or poverty, or you're wherever you are in your context of your world, it becomes more complex. And it's because we know more about ourselves, and then we have outside forces that are just, we're global. There's no question. Facebook and Google impacts farming in Southeast Kansas. I could tell you whole stories about that, but they do. So that being said, we have to continually remind ourselves we got to do all we can, for as many as we can, for as long as we can. The mantra that is here. So I think you're going to see continued growth because it's the right thing. We do the right thing. We offer the right thing. We serve in the right way. So I think you'll continue to see growth only because success builds on success and trust builds on trust. So there'll probably be more of us, and I hope so. And we'll just be serving more people.
And as the world gets more complex, not less complex, Community Health Center Southeast Kansas will continue, by everything I can see, to continue to grow to meet that complexity and serve folks here in this region as best as you can.
Absolutely.
Well, this was a great conversation, Dan. I really appreciate your time, and thanks so much for having us.
You just heard Health on the Plains. Look for new episodes twice per month. Follow us on social media and continue to listen to the latest episodes wherever you regularly listen to podcasts. Learn more at khi.org/podcast. Thanks for listening.